Right here on TRAXX Momentum. I'm your host, Anil, on the mic. It's a beautiful Monday morning, and today we're going to talk about things that concern the heart, not the mind. The heart is a vital organ that I read starts beating as early as 35 to 37 days of gestational age from the point we get conceived as embryos in our mother's womb. And it doesn't stop working. It's one of the most hardest working organs in our bodies. And today we're going to dissect, not our body, we're going to dissect the topic and find out in deep about the topic that we have today, which is congenital heart defect. And we're going to speak to an expert today, a no-nonsense conversation. And with us in the studios is internal medicine and clinical cardiology consultant from UiTM Private Specialist Center, Dr. Huzairi Sani. Doctor, good morning.
Hi, morning.
Welcome to TRAXX. How are you?
Thank you very much, Anil.
Okay.
Very good.
The pleasure is ours. Now, I know you told me this is your first time on radio.
That's right.
Let me tell you this. Conti number 5 has got a lucky charm. Every time I speak to someone who tells me that this is their first time on air, they go out to do great things on radio and on the media. So today is a great beginning for you, Doctor.
Hopefully so.
Great.
Thanks.
So, Doctor,
Okay.
Yeah. So, tell us, what really is congenital heart disease?
Okay, so by the name itself,
Yeah.
congenital heart disease, so it's defect of the heart, which rightly mentioned, it's from before birth itself.
Right.
Okay, so it happens during gestational period, and then it's then come into life, right, when the baby is born. So meaning that since the newborn, the person might have this defect, and it is due to a few reasons.
Yeah.
Okay, as we know, so the heart is a complex organ. We have the right and left. We have the two chambers on the top, the atriums and the ventricles, and we talk about this congenital heart defect. It's a very broad term. Okay. There are many divisions of classifying this heart disease. It can be the right side, can be left side, can be a hole, as we usually discuss in the public, because of the hole in the heart, or a narrowing of a vessel, or is the valve problem, or the muscles. So this congenital heart defect can be any of this, right? And depending on how bad is it, a patient or person can live long with it until they become an adult, or it can also be a life-threatening condition the moment they born.
I see.
Itself, yeah. So depending on the diagnosis, which actually we can diagnose even during gestational period.
Right.
Yeah. Now the technology
is
the
advanced.
science is advanced. We can even diagnose even before the baby comes out.
Treatment can only start once the child is born, or can it already be administered while it's in the womb itself?
Treatment-wise, because we need to further investigate as
Right.
well. So there are also scans and tests, which is usually done after the baby is born, and then also the treatment will follow
through after that.
the
I see.
investigations.
Okay. Now, talk to us about some of the most common symptoms or the complications that occur to a baby, maybe, that is suffering from congenital heart disease.
Okay, so when we talk about symptoms and signs, it's also very broad. Okay, it can be sometimes they not have any symptoms at all, which is sometimes incidentally diagnosed when they are adult by, when the doctor put the stethoscope on the chest and hear something, then only it has been diagnosed. Or sometimes the child may have like a bluish discoloration since they are newborn.
Right.
So there is more life-threatening, more serious diagnosis. So when the diagnosis is more serious, the tendency to develop complications much earlier.
I see.
So those with usually no symptoms, they have the tendency to develop complications much later. And when we talk about symptoms, of course, when the child, when they are newborn, they cannot communicate, right?
Yeah.
So we examine them.
Yes.
So we have this screening of newborns in our healthcare system, where we screen and we auscultate and check the baby. Is there any features of abnormality, or we hear of any heart murmur to detect any congenital heart disease.
Murmur.
Yeah.
Describe that to us, doctor.
Heart murmur is like a sound when we put on the stethoscope. To put the
Normally, you look for a heartbeat. Tuk, 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 heartbeat.
Yeah. So this is an extra sound which is abnormal.
I see.
So usually it's lapped up S1, S2. Lapped up.
Okay.
The valves open and closes. But now there's abnormal flow.
Right.
So you have like lapped up zzz or zzz lapped up. So you have that extra sound.
Okay.
Which further needs to be confirmed by echo and chest X-ray, ECG, and so on.
The sound of life in medical terms, lapped up. I discovered that today. That's how doctors describe the heartbeat. Lapped up. But otherwise, in congenital heart defects, it's lapped up or some other murmuring that you just mentioned, right?
That's right.
So how does this happen then, doctor?
So this happened when in the gestational period itself. So that time is very crucial for the mom, especially to be having a healthy lifestyle, a healthy medical status of not taking, because certain things are not modifiable, certain things of risk factors of having this are modifiable. Okay, so of course non-modifiable are the genetics. So you can't do anything for now to the genes that we are carrying. Like mother's medical condition during pregnancy is also important. Whether they are on any medication, are they, or do they have
diabetic?
Like correct other tablets or medications that affects the pregnancy, mother smoking or consumes alcohol
as well.
Yeah, so these are risk factors also. They have congenital defect or any infection such as rubella during pregnancy may also affect the baby.
The baby as well.
So after they have grown up, when they are like 2-3 years old, so other signs also that we can see the child is less active compared to the friends. When they go to play with the friends outside or in the school, they will notice that the child will not able to perform like the other kids.
I see.
Yeah, or they will like complain. They are breathless. They are not able to run as fast, not able to run as much, and then they will take frequent rest.
I see.
So they
so
those
they experience fatigue very often.
Yeah. In a more serious condition, the cyanotics, the bluish kids, so they will turn blue after when they exercise. They will turn blue, and then they will take a rest, and they get better again, and then only can continue again. Yeah. So
supposing doctors with advancements in medical technology, they intervene and they found out that a fetus in the mother's womb has got congenital heart defects. How soon after the baby is born should intervention be done?
Okay, so that's a very good question, because at the same time also in the medical field there are also some difference of opinions depending on the diagnosis, of which some conditions we will do to monitor first before we do any intervention, whereas some conditions which is more critical that they have to do during the first 30 days of life itself.
First 30 days of life. Right.
So there are also difference of treatment and opinions and on the when to intervene.
Right. Okay, great. Doctor, we're going to jump in for a quick break. When we come back, we'll talk about some of the tests that are performed to identify congenital heart defect. Today on Health on TRAXX, I'm Anil on the mic. And sitting right across from me, I'm speaking to Dr. Huzairi Sani. He's an internal medicine and clinical cardiology consultant at UiTM Specialist Center. Health on TRAXX will be right back after a short break. Keep it right here. Health on Tracks with me, Anil, on the mic. And today with us in the studios, we have Dr. Huzairi Sani, an internal medicine and clinical cardiology consultant from the UiTM Private Specialist Center. And today, Dr. Huzairi is talking to us about congenital heart defects. Doctor, welcome back to Health on Tracks.
Thanks, Anil.
Now, Doctor, give us a perspective and, identify and talk to us in detail about some of the tests that are performed to further confirm the diagnosis, so to speak, when you suspect him.
All right. So, after we have suspect a child with or an adult with a congenital heart disease, we will ask further on a few specific questions, whether is it inherited conditions or what are the possible causes. So depending on that, then we'll proceed to investigations, which first is the blood test. So blood test, what we can know about this is, one, we can do a genetic study, and number two, also we can also know how stressed is the heart is. Subsequently, it's imaging test, which is the chest X-ray. You can see which part of the heart is, chambers is enlarged or big, and then followed by echocardiogram, which we look at the heart contractions, the valves, the muscles, the vessels as well, and then we can also measure the pressure and flow of the blood in the heart chambers. Those are some of the non-invasive, meaning that from outside, such as another test is electrocardiogram, check for any abnormal beating, whether it's too fast, too slow, and also whether the rhythm is okay or not. Next is like MRI or CT scan. MRI is the one that you go inside a tunnel, and that will give you a whole shape or morphology of the heart. You can see the vessels in out of the heart, the size of every chambers, and then how's the valve as well.
I see. So you can simulate can there a simulation be done to see whether the heart is performing the way it should with the morphology? I did see somewhere that...
it's actually, the heart never stops, right? So we are recording the flow as well as the contractions and the movement of every bit of the heart. And of course you have the invasive ones, where we go in through the vessels, go through from the vein, go to the right heart, left heart, and it can measure the pressure inside the chambers as well as the saturation, because sometimes some diagnoses, they may have a mixture of the oxygenated and the deoxygenated blood.
I see.
So we can confirm that by going specifically to that area and take a blood sample and see what's the oxygen level. So that will give us a more specific study and also the diagnosis.
Now that we understand about the test, let's talk about the treatments, doctor. What are some of the treatments that are available for this condition?
So for anyone with any congenital heart defect, the follow-up is of course lifelong. Whether it is treated or untreated, it has to be followed up. One is medication. Two is devices, advances of the devices, and number three is operation, surgical intervention. So of course, medications has its pros and cons. You have to take it every day. You release certain symptoms or pressure, but if it's a structural problem, it will not get better, because it is something from congenital birth, right?
It's something to do with the anatomy of...
So at the same time, we have now devices which we go through the vessel to reach the heart and implant it there.
I see.
So we can close a hole or defect, or we can also do structural repair without cutting and going for operations. Of course, those with more than one defect, more complex, require surgical intervention. that has to be done in specialized heart center. On when is also depend on how severe is the condition.
So assuming it is reached, or rather it's at the worst case scenario, when would a heart transplant be necessary? When would you determine that?
Yeah, so heart failure is one of the complications
Right.
of congenital heart disease, and if we have maxed out on the other therapies, we have tried medications, tried devices, tried repairing or replacing certain parts of the heart still not okay, then
heart transplant.
heart transplant is there.
It's a very interesting thing to talk about, doctor, because I'm naive, and that's the thing I love about Health on TRAXX, is to have experts like you to give us a perspective, take us to a place that we've never even thought our minds would have this conversation. How early or how soon can we perform a transplant on babies?
Not the transplant on babies.
Mm.
Of course, transplant is only
how soon can it
for the adult.
Right.
For babies, it is always best to have the natural, normal things inside. So we will try to repair whatever defect we can.
Right.
If you can't repair, then only we try to replace.
Okay.
Yeah. So and of course, these procedures comes with risk. So it's a very big decision. You have to get the doctors, the family, the bigger picture.
Yeah.
Because we're talking about a person's life and death situation.
Yes.
So meaning that if we even go to do a invasive or surgical intervention, how long will it last, or what's the future going to be? Whether is it best just to continue with medications rather than taking the risk of going through a major surgery? And of course, we also have to look at the whole picture of the candidate or the person, whether they themselves would willing to go for major surgery, and other medical conditions, the background, or after recovery, who gonna take care of them? Are they able to function back as normal? Are they now happy with their baseline, or meaning that whatever they are doing now, taking the risk and getting worse after that? So there are many things need to consider, and of course it is always being followed up, and always best to inform or go for a checkup if there's any whatever new signs or symptoms that the patient or the person may have.
Okay. You mentioned about a patient being happy with their baseline or not, right? Which leads me to my next question. Quality of life of these people.
Yeah.
To what extent does it affect them, and what are some of the modifications, so to speak, that they have to do on their lifestyle so that they can just have a normal life?
So the most important thing here is first is to have the idea of the diagnosis of the medical condition that they are having, and then depending on that, they only will discuss on the things that whether they can do, they cannot do, and how frequent you have to see, and so on. Because sometimes to understand the diagnosis, accepting it's another thing, to the patient, to the family members, parents, is also not easy. So understanding, have the idea, subsequently we will see how they progress. We will of course want them to function or do as much as they can. But we will also see on the investigation part and advise accordingly. And the expectation is another thing. Of course, who doesn't want to have a healthy life, right? And then when, especially kids, when they would want to have enjoyment with their friends,
just like their friends. Okay,
that's right. So so it's important to first really understand about the diagnosis, how the disease going to progress, what are the treatment and options available, and then we're going to, depending on that, to see how's their performance of daily life going to be.
I see. Okay, great. Let's jump in for another quick break. When we come back, Doctor, you're going to tell us how we can take good care of our heart right here in Health on TRAXX with me, Anil, on the mic, and Dr. Huzairi Sani. With us in the studios today is Dr. Huzairi Sani, an internal medicine and clinical cardiology consultant at UiTM Private Specialist Center, and today we're talking about congenital heart defects. Now, Doctor, you spoke to us about congenital heart defects, early intervention, tests, medication, so on. Now, it would be a waste if I never asked you this question. How do we take good care of our hearts, Doctor?
Okay, so first, we need to know there are certain things that is beyond our control, so things that is our control. So of course, things which is our control is our daily lifestyle. Okay, so things that cannot control is like our age, our genetics, okay, our gender. So we can't change all that. Okay,
right.
But so we will focus on the things that we can do to make our health better. First is, of course, we must, if we have any symptom, we need to go for screening. We need to go for a checkup to get it diagnosed, make sure that it's okay or not. And of course, those with no heart problem, living a healthy lifestyle is very important, because like you rightly mentioned, the heart has been working from the day you were born, and continuously to work and only have rest at rest.
Oh, right.
At night, when we rest.
Resting.
Yeah. So, you must have a balance here. So, you must make sure that the heart is not at stress. Okay. Must do enough exercise. Okay. Must eat healthy lifestyle. So, because the heart is like an engine.
Yes.
It's an engine to the whole body. Okay. So, you must take care of this engine. So, when we consume food or drinks, it's like the fuel to the engine. So if you take unhealthy fuel, then you're going to harm the engine. So
you got to take high grade engine fluid. No modifications, huh? No modifications available.
Yeah, that's right. So it's very vital.
Very vital.
And you only have one organ. That's right.
Yes.
So a lot of nowadays issue is not only the food but also the drinks. There's a lot of sugary drinks. And healthy drinks as well. So exercise, fasting is also good for the heart, and of course other things like your blood pressure, your cholesterol, sugar, and then enough exercise. Not too heavy. Also. Not too little, because we also in the sedentary
just like
age.
Radio DJs. I'm sitting down over here 4 hours, no movement. The only time I get is when I walk out of the studios. Sedentary lifestyle, right?
A lot of people or patients sometimes say that they are busy with the occupation and so on nowadays. You know, but it can also be done in-house, meaning that inside the house, you don't have to go outside. You don't have to register the gym, or you don't have to blame the weather. So you can even do it at night, 9-10 o'clock p.m. or early morning, 5-6 o'clock is fine.
If you were my cardiologist, I will definitely take everything you tell seriously, because you look like a fit man yourself. So you've been doing a great job in keeping yourself fit. So now we know, we've got to keep our heart happy, right? A happy heart is a healthy heart. So that starts with things like food, our lifestyle, of course, smoking. All these things contribute towards that. And now I wondered this. I know I should have asked you this question earlier on in the conversation, but I'm going to dig deep into your persona, Doctor. What led you on to pursue cardiology?
Oh, okay. That's a very interesting question.
Sure, that's what we want.
I think It's many reasons
Right.
to answer that question. So just to mention a few, one about the heart is it's not only the physical, but it's also the internal.
Right.
So you must appreciate of what you have, and also number two is the burden of the heart disease also a lot.
Okay.
So I think the demand and supply is also
okay.
very much so. And I think we can. I personally think that I can contribute more in the heart field. So
Okay.
hopefully, yeah.
Inspiring. We should have more conversations with you, Doctor.
Yes,
Unfortunately,
why not?
time is of the essence. But before I let you go, 2 questions. Any parting words? And I want you to debunk some very common misconceptions people have about heart conditions. The fallacies that you always hear, that you think, these are all wrong things. People have a very different understanding, that you want to use this platform to send that message out across to our listeners.
Okay, I think outside there, there's also a lot of wrong messages or wrong information which has been
circulating.
Yeah, correct. Through WhatsApp or through media or whatever platform it is. And sometimes people tend to believe it so much, and they just continue following it. Sometimes when it comes to even a lifestyle or supplements, taking pills, these things that you need to research and analyze and get the expert advices before consuming for your own body. Because we need to have the evidence. Yeah, the pros and cons. We need to know exactly.
That's why we need to see a cardiologist like you, right?
And not to trust any messages or circulating messages from which is spreading.
It is sometimes is a bit appalling sometimes, and it's very sad to see older people who come across some news that is being spread via a messaging app, and when you ask them, where did you hear that from? Oh yeah, I heard it via this messaging app, as if like it's the gospel, like they heard it from the New York Times or from Times Magazine. Because sometimes you got to excuse them, they're naive, they don't know, and it's down to people like us to go out there and educate them. Dr. Huzairi Sani, thank you so much.
Thank you very much
for setting aside your time.
Thank you for having me here.
You're most welcome, and we look forward to having you once again in the studios on another discussion concerning the heart.
Sure.
Thank you very much for opening up our minds and also opening our hearts today. Thank you, Doctor.
Thank you.
You're welcome.